Diabetes management is essential to a person's life because the amount of sugar that your body consumes can become dangerous. If not managed properly with the right nutrition, exercise, and mental health guidance, could result in more health issues or possibly even death. Studies have shown that about 25,000 people die each year from diabetes due to not properly managing their nutrition diet. Counting carbs is the most important part of managing your diet. The level of sugar consumed by your body can become toxic in one or two ways: too high or too low. Knowing what your carbs are and how much your body can consume is very important. By knowing will help make it easier for you to control your diabetes. To help have a healthier, longer life, plan your diet with all of the whole grains, fibers, proteins, and carbs according to the diet that your health provider plans for you. Limit the amount of red meat, carbohydrates, fruits, and sugary snacks that we love to eat that can cause an increase in sugar. Continue to check your glucose daily, maybe even a couple of times a day with your meal intake to better manage your diabetes, and take your insulin or your pills as directed by the doctor. Being in control of your diabetes with a healthy diet can prevent you from having health conditions such as heart failure, high blood pressure, neuropathy, or even death. The next part in managing your diabetes would be exercising. You will be exercising for two reasons. The first reason you would exercise is to help control your diabetes. The second reason is to prevent problems with cardiovascular, such as cardiovascular heart problems and high blood pressure, and to help burn carbs, because exercising can also lower your glucose. The American Diabetes Association recommends exercising at least 30 minutes a day to prevent problems with your heart. There is no limit to the type of exercise that's needed for diabetes. Therefore, cardio, yoga, swimming, and etc., playing basketball is okay, just as long as it's 30 minutes a day. However, due to the fact that exercising can, as I stated earlier, lower your glucose and can increase your glucose when you are doing a strength workout, you have to monitor your glucose before and after exercising. That's highly recommended. The World Health Organization, which is known as WHO, states that over 1 million people die each year from diabetes due to the lack of exercising and by not having a proper diet. To expand life with diabetes, eat properly, exercise for the recommended time of 30 minutes a day. Monitor your body. Report any signs of dizziness, low glucose levels, high glucose level, anything that is unusual with your body that can cause other issues. The next step would be when your body experiences any type of changes, you can develop some mental health issues. Having diabetes, you can experience rapid mood swings, anxiety, feeling fatigue, and maybe even lose the ability to think clearly, which in some cases is normal. Some test studies have even shown that with either diabetes type 1 or type 2 can experience symptoms of diabetes stress, depression, and not limited to an eating disorder. It is highly recommended that you communicate with your doctor about any changes with your body to develop a support system to help prevent any mental health breakdown. Understand that diabetes is manageable, and with the right help and support can be controlled. In the U.S. National Library of Medicine's National Institutes of Health published in PMC August 20th, 2015, that mental health comorbidities of diabetes compress adhesive to treatment and thus increase the risk of serious short and long-term complications, which result in blindness, amputation, stroke, cognitive decline, decreased quality of life, and premature death. To prevent any of these comorbidities, that can complicate diabetes in a short-term or long-term state, use the treatments that your doctor gives you to sustain a longer quality of life.